Working together to make a better community.
Welcome to Community Conversations. I'm your host, Steve Mantis, and my guest today is Judith Monteith-Farrell, our MPP for Thunder Bay-Atikokan. Welcome, Judith.
Hi, Steve. How are you?
I'm good today, and well, when the sun comes out, I'm particularly good. When
Yes.
I get to see the hail or the or the sleet coming down, I'm a little bit discouraged. And we're recording this now, the first week in May, for our viewers. It's it's still spring is coming, but we're not quite there yet. It seems like. So Judith, you've been our MPP for, if I got it right, about 2.5 years now. Um, I'd like to ask some of your reflections from those 2.5 years. What have you learned so far as our representative? And what's really kind of surprised you the most about the job?
Well, it's been almost 3 years, Steve. So in June. So hard to
Oh,
believe.
right.
Yes, and the time has really flown by. It is really exciting to do this work. I am thrilled to do it, and I'm thrilled to represent the people of Thunder Bay-Atikokan. And I knew in my heart of hearts that I had great constituents and a great body of people in our community. But with the pandemic and with the support that we've seen for so many causes, I'm always very extremely proud to represent this area. And the thing that I've learned, I think, the most is that my majority government is a very difficult and ship to steer if you don't have goodwill and parliamentary goodwill in the House. And that is something that I felt that the decorum, especially in early days, was completely unacceptable. It was almost a violent kind of atmosphere. It's calmed down, but it is still a parliament that is not functioning the way I would like to see it function. Committees have been circumvented or done very quickly. There's very little public consultation or public committee input because the bills are not traveled, even if they can be done virtually, which we do our committee work virtually. So you're able to do it, but it happens very quickly. They'll schedule the committee and it'll be over before people who are interested in that even have an opportunity. And that's how democracy works, is very much in the committee system, where legislation is proposed, but then you put it out to the people to actually comment on and to give the perspective of different regions, different interests. And then you amend that legislation so that it's more reflective and more all-encompassing in the good it does, or and the regulatory kind of review. So that and missing that, we've seen in this parliament many pieces of legislation that have had to been walked back. They've been challenged in court. And then the government has to propose another piece of legislation to actually correct the legislation because it's unconstitutional, and that could have been avoided had we slowed down and done the work properly. But other
So
than that,
just to clarify, oh, sorry.
sorry.
So to clarify, so you're a member of the NDP, the Ontario New Democratic Party, which is now the official opposition, and it's the Conservatives under Doug Ford that are that majority we're talking about. So
Yes.
so that really affects your role, is what I'm hearing as an MPP. That the government is going ahead with their agenda and in a way not really involving the opposition or the third party in that process. Did I get that
They,
right?
there's opportunities in committee for us to have some discussions, but it's not as full and sort of all-encompassing. It should have been more cooperative, especially in these times. And had we, as official opposition, I think we've done a really good job, because many of our things that we've hammered home on, we do get some compromise, like sick leave, along with our the people in Ontario who are also very concerned about those things. But it is like they're on a path, and it's failing to, they don't want to waver from that path. Like, and that is not a sign of a good government, I don't believe. So we in the official opposition have opportunities to challenge and to talk about, put forward our ideas around the long-term care. We have a platform that almost that we put together and have presented to the government many months ago. We presented legislation that complemented those things in long-term care, and now we see in the Long-Term Care Commission those things that we were actually telling the government is the way forward. The commission has now come out many months later saying exactly what our platform said to them. And so, that's kind of, we wish they would have listened. We don't want to be in the position of saying, I told you so, but it is a position that, we know that we were on the right track because, independent bodies have said, yes, this is the way you should move forward.
So tell me a little bit more about the issue of long-term care and the commission that you mentioned. Who was that, and what were they reviewing?
So what happened was long-term care has been studied to death and in the previous government, by unions, by groups. What they've said is that, there was a crisis in long-term care. And now there's, this government had said that they've created a ministry of long-term care, but what happened was when the pandemic hit, we saw a gross failure in this province to address the special needs of the long-term care system and the residents, and that we've seen almost 4,000 people die. And that is a shameful thing. What happened was everyone agreed that was horrific. The Canadian military was called in. There was countless articles. And Steve, really, the most difficult work of all the MPPs is to listen to the families' stories, to listen to people in long-term care calling out for help, listening to the workers, doctors, nurses, PSWs, all saying that this needs to be changed and this was unacceptable and people were suffering and dying. And when it was at its worst, when many, many people were passing away and ill in long-term care, we were hearing those stories, and it was very frustrating that it had come to that. So even the government realized that, and we had asked for a public inquiry. So a public inquiry, that answers the Parliament. So it's transparent. It would involve people that would be assigned to do that work, and they report to Parliament. What this government did is they did a commission. So they handpicked some people and qualified people to do the work of studying what happened in long-term care. What was that piece? Now, the Ombudsman also did, the Auditor General, also did a piece on it. But this commission, their only task was to look at the conditions on what brought us to this terrible place. Now, they asked for more time to complete their work, and the government refused. And so they came up with a report, and they presented that last week. And it was, like I said, very shocking, triggering for lots of family members, but really outlined what needs to happen to avoid these things in the future. And will we see that? There is no mandate, it's just information like all these other reports we had on long-term care. So now our job is to, and we have pieces of legislation that are already either in committee or have been put forward by our party to say, this is the way forward. The commission is saying it, and we're saying it. And it's really a moment in time, Steve. Like, if we don't fix care, what are we saying as a society? It is something that's long overdue, has been in crisis for many, many years through the former government, this government, and we really need to fix it.
So, this is really, as they say, a hot topic very timely with COVID pandemic. And of course, we know the long-term care homes were really the hardest hit, or one of the hardest hits,
Yeah.
part of our society. And from this government, we've been hearing kind of different things. We heard from the premier that he's going to hold those long-term care homes accountable for the lack of whatever protection for the members. But then we hear, oh, they passed a law that says that the owners of the private long-term care can't be held responsible, can't be sued. And I'm kind of going, well, what are they saying? How is this? From your perspective, how has this government responded to the crisis in long-term care?
It was very disappointing when they passed a law that included long-term care homes that said that no one could be held liable for the conditions around COVID unless we could prove gross negligence, and like a higher standard, not just negligence, but gross negligence. Now, people are still going to try that, but it is a higher legal threshold to overcome. And we see that the government said a lot of things about, the ring around the long-term care homes. We had that opportunity in the first wave. Okay, let's say they made a mistake in the first wave, but we did not see, other than hiring some inspectors that didn't give any kind of fines or any kind of directions, very few directions to employers. And so we saw the second wave, and we saw another round. And that's where in Thunder Bay we were hit in our situation. So the frustration was that there was nothing done differently between the lessons were not learned in the first wave to the second wave. And so that was identified in the commission's report, and that not enough was done.
And so what is the NDP recommending should be done going forward?
But we have some things that are timely right now. The 4 hours of hands-on care, which is the government has committed to in a budget, like as part of a budget bill with no money attached. And they put some dollars towards training. But we see a need to have an immediate hiring of PSWs, and we know that many are leaving the field, and after COVID even more are leaving the field because they aren't paid properly. They're not full-time jobs. They have no benefits. It's not a job that they want to risk their life for anymore. And many leave just because they're so disheartened with the conditions. Too many people to take care of, and they feel they don't want to be part of a system that's actually abusing people. And because many, they love their residents, they love their work, but at some point they just break down or are injured because there's too many, they're just taking care of too many people. So we need to improve the conditions for PSWs and hands-on care. We need to establish standards that must be adhered to, and proven, and we need to regulate that. We need to shift our thinking on long-term care, because long-term care and home care are connected. And many who are involved with the home care system also know that that's a train wreck and has been for years, and is insufficient to keep people in their homes. And many people could stay home if they receive some care. And families who are taking care of their elderly need to be recognized in some way and supported with, either financially or with support systems. And we also need to be a movement towards, like many other societies have done, is moving out of the institutional kind of framework of long-term care as a warehouse of 200-300 people who need a lot of care, to a community-based kind of like villages of people with Alzheimer's and with care, a more home-like setting similar to some of the home care settings we have for other people who require support in our society. So there's different models that need to be looked at, but really the key piece is to getting people and resources in place. The other thing we really need to seriously look at, and what is in our platform, is shifting from for-profit to not-for-profit and publicly owned institutions where you can regulate. Because the private, like I've said it a million times at Queen's Park, not a million, but many times, not 1 cent should be going of care dollars should be going to profits. That these long-term care homes who had many casualties during COVID actually paid dividends. They didn't hurt. There was nothing that happened to them. They paid dividends to their shareholders during this time of crisis. And if nothing highlights sort of the drastic things that need to happen around this, we need to shift that model. It won't happen overnight, but we can work towards that with a intense and kind of thoughtful approach. And there are many reports and many people with good ideas.
The experience in long-term care that you're talking about seems to me to be somewhat reflective of the overall approach of this government. In terms of thinking about how important the workers are and how we value the workers or not, by whether it's for paid sick days or minimum wage. It seems that it's the businesses and their right to make a profit seems to trump oftentimes really protecting and supporting the workers. As viewers know, I'm active with injured workers and workers' compensation. This government has made changes at workers' compensation that lower the amount of money that the employers have to pay. And whenever they make an announcement, that's what they're saying. Oh, Mr. Employer, you're paying less because, we're in charge. And at the same time, we're seeing the big corporations have like major profits, and that income inequality is getting wider and wider between normal people, normal folks here in Thunder Bay, and those folks at the very top. Am I getting the right picture in terms of the focus of this government?
It's definitely focused on business, and not that business is a bad thing.
No.
In any and making a fair profit is good, and creating jobs is a great thing. What we need to do is balance, though. We need to have the balance between the most vulnerable and cutting the first order of business was cutting the increases to minimum wage, cutting paid sick leave. That's one of the first things they did as a government. That was a clear signal to workers that you don't matter, because there was demonstrations, there was frustration, and people felt very disheartened. And then we have a government that says for workers, but there hasn't been one piece of legislation that has been put forward or one budget that has done anything to assist workers or workers organizations or WSIB that is of the workers side of things. And so you can say all you want that you're a friend of the working people, but when you don't, and maybe you think buck a beer is the way to their hearts, I don't know. Some of that messaging is very problematic, but it is so true that when people like Saul, people like myself, many of my colleagues stand up in the House and say, do you know what it's like to live on even $15 an hour? And do you know what it's like to have to work 6 part-time jobs because you can't? Do you know what it's like to have no benefits? You can't take a paid sick day to go get tested because A, your employer is going to get angry with you, and B, you need that money. You need that money to pay your rent, to feed your children. Mm-hmm. And sometimes I think there's just such a disconnect, between the people that are there making these laws and people who really need their governments to step up and to ensure that, what we all believe is in place, the safety nets that, injured workers believe are in place. If I get injured on the job, I'm going to have a safety net. If I become disabled from some other kind of thing, they don't realize that in our country, you're going to have to live on, less than $1,200 a month. And who can do that? We continually say that because I think it's important to be on record that these are the voices of people that don't have a lobby group to speak for them. And, we need those voices heard. So I think we've done a good job in sort of that part. I'd really like to see a real commitment from this government towards eliminating poverty.
I'm with you there. So we're all hopeful, that this pandemic will kind of come to a close soon, and there's a lot of talk about what happens when we don't have to focus so much of our energy on protecting the immediate health, really, of our citizens. There's different programs out there around, getting back to normal or building back better. What's the NDP's position around that? Where do we want to go after the pandemic?
I think we're all going to be changed by the pandemic. And when people say, I want to get back to normal, and I'm saying, I want a new normal. And I think that's what a lot of folks are saying. That, for many folks, normal that wasn't a great time for them. And we're going to look at having to support a couple things. One is mental health, I think is going to be, and education, because we know that this pandemic has been difficult for children and their families, and so we're going to need to really focus on that. We're going to really have to focus on building a system that's actually able to support if we get another pandemic, or if we have the or whatever. That will be important to ensure that we learn the lessons of this pandemic, not like SARS, where we just forgot about it and then weren't prepared. And the other piece that's very important to all of us, if we don't take care of our environment, then we are in a bad way in the world. So, and many young people, many older people, a lot of people are very, very committed to trying to make that our approach to the environment better. And we see sort of piecemeal, but we have a Green New Democratic deal, and it's one that is focused on jobs and justice, like environmental, not just that, the poor working person has to pay all the price of that. We look at how do we implement an environmental plan that includes green jobs and retraining, and, that doesn't leave the workers behind. And so that's exciting. And then obviously there's many pieces to the platform, but many of us are very committed to, ensuring that is sort of our focus going forward from this pandemic, that it is hopeful and that we can build something from that.
So, in politics, in a way, the flip side of providing kind of programming is where does the funds come from? In terms of paying for those programs. Where's the NDP at in terms of raising revenue? Any changes on that front in terms of your policies or plans?
Well, we haven't, we make no secret of it. I mean, government pays out a lot of money to a lot of different folks, and it's not all poor people. Many corporations, many businesses, many different facets receive government funding. So I think that's something that has to be reviewed. I'm on the estimates committee. It's amazing on where the government spends its money, because we get to review on where they spend their money. But the piece that, is going to be clear that we're going to have to probably look at some sort of wealth tax. I mean, we haven't looked at what that looks like. And we're talking about the people that are extremely wealthy. There are extremely wealthy people and corporations in Canada, and they, in my opinion, don't pay their fair share. Corporate taxes has been reduced to, some of the lowest in North America and in the world. And so that's not sustainable when you have 14 million people and you want a social infrastructure for. And so rather than, cutting in public services, what we'd like to see is a program where we are able to generate revenue. The other thing is when you have a healthy economy and you're creating jobs through, different things, people are paying their taxes. And, we don't foresee any tax increase, obviously, on working people, but it is that top, even half of 1% is where we want to look at. And sort of see that's one area. And then once you're there, I think, like I said, I think the two things, we're expecting a boom after the pandemic. There'll be a lot of generation of wealth in our province because we are a wealthy province, but we also have to look at that 1% and see, are they paying their fair share? Sorry.
So, Judith, in a year from now, I guess we're going to be gearing up for or in the midst of a provincial election. Do you see what key issues might be coming up in that election, or any advice to the electorate?
I think, yes, in a year's time, we'll be in the middle of our election campaign because the election is a fixed date, and in June. So I think that it is important that people really look at what's important to them. In Northwestern Ontario, the themes are healthcare and jobs. Sorry, and the environment. I'd say those are the top three things. And so people want to see that Northern Ontario gets its fair share. And I think that we all often see a lot of promises from other parties. But I know that in the NDP, we have 9 now MPPs from Northern Ontario. We have a Northern Caucus. We're a strong voice in in our caucus. And so, I'm really excited about the next election, and I'm, looking forward to having that Northern kind of focus.
So, Judith, we're just about out of time. If folks want to get a hold of you or your office, what's the best way for them to do that?
My office number is 622-1920, and if they want to email me, it's you want it to come right to me. It's J Monteith MONTEITH -Farrell FARRELL, all small case, at ndp.on.ca.
Well, thank you so much for coming on the show. I sure appreciate it, and stay safe, and we'll see you again soon.
Thanks, Steve. It's always a pleasure talking to you, and I really am looking forward to when we can actually see each other and I can give you a hug.
Right on.
Take care.
We'll make a date. Thank you.
Thanks.
Working together to make a better community. We can create a brighter day.